So this clavicle actually holds the scapula at 30 degrees to the coronal plane. Medially, it articulates with the sternum and laterally with the acromion. The innermost structure in the sternoclavicular joint is a meniscus which starts from the sternum and holds the medial end down. It is surrounded by the capsule, which is strengthened by the anterior and posterior sternoclavicular ligaments, the interclavicular ligaments, and something which is very important, which is the costoclavicular ligament. So it's the costoclavicular ligament that holds the medial end of the clavicle down, and it must be repaired if you want to treat the subluxation of the sternoclavicular joint. Another structure that holds it down is the subclavius muscle. Therefore, this much about the medial end of the clavicle articulating with the sternoclavicular joint. Similarly, the lateral end of the clavicle is held down by the coracoclavicular ligament. The coracoid is a finger type projection from the scapula, which is a bent finger directed antero-externally, and the coracoclavicular ligament holds the lateral end of the clavicle into the articulation with the acromion. So the acromioclavicular joint is stabilized by the coracoclavicular ligament, which has got a trapezoid and a conoid portion. You see the clavicle is a S-shaped bone with a flat lateral 1/3, concave forward, and a triangular medial 2/3, convex anterior. Now, the muscles attached to the posterior border are the trapezius and the sternocleidomastoid, the clavicular head of the sternocleidomastoid, and the muscles attached to the anterior border in the lateral 1/3 is the deltoid, and in the medial 2/3 is the pectoralis major. Now, if we take off the pectoralis major, underneath you will see that there is a muscle arising from the sternum and getting inserted into the subclavius groove, which is split from the inferior border of the clavicle. So the 5 muscles are the trapezius, the clavicular head of sternomastoid, the deltoid, the pectoralis major, and this very small muscle subclavius. Now the importance of the subclavius is that it is supplied by the nerve to subclavius, which originates from the Erb's point, which is the congregation of C5 and C6 roots, divides into anterior posterior division, and then gives 2 nerves, the suprascapular nerve, which passes parallel to the posterior belly of omohyoid through the transverse scapular ligament, transverse scapular notch, supplying the supraspinatus and the infraspinatus. Then there is a nerve to subclavius, which you see here, which comes to the subclavius, but it also gives a nerve which is the accessory phrenic nerve, which winds round the subclavian vein and gets continuous into the main phrenic nerve, which is winding round the scalenus anterior muscle. Now this nerve can hook the subclavian vein, cause stasis, and is responsible for spontaneous axillary vein thrombosis. So this nerve to subclavius is important because it gives that accessory phrenic nerve. After this, we see that between the sternocleidomastoid and the trapezius, there is a deep fascia of the neck which is called as the general investing layer of the deep fascia of the neck. This fascia winds round the clavicle and starts from its inferior border and goes on to the superior border of the pectoralis minor muscle. So this is called as clavipectoral fascia. You can see that this deep fascia would be on the chest, on the costal muscles, in the medial part, but on the lateral part, it will be continuous with the coracoclavicular ligament. So it is not only called as the clavipectoral fascia, but also as the costocoracoid membrane. Four structures that pierce this fascia. That is a very common question that is asked to you. Is the cephalic vein, the lateral pectoral nerve, the thoracoacromion artery, and the lymphatics from the axillary tail of Spence, which spreads breast cancer into the axillary lymph nodes. Let us now draw the clavicle and revise what we have already learned. If you are looking from in front, the lateral 1/3 is concave forward and the medial 2/3 is convex forward. So I said that since it is triangular, it should have an inferior border, but on the medial end, the inferior border is actually concave because it includes a groove for the subclavius muscle. And this inferior border would go right up to the tubercle at the junction of the lateral 1/3 and the medial 2/3, which is called as the conoid tubercle. And from there it will become the inferior border of the lateral surface, which is just a line, and that is called as the trapezoid line. So a trapezoid line and a conoid tubercle. And the inferior border has become the subclavius groove. Then we told you that there is a meniscus which starts from the manubrium sterni and actually holds the medial end of the clavicle into the sternoclavicular joint. So this is the manubrium sterni, the articulation of the manubrium sterni for the clavicle, and this is the articulation for the first rib, and then the sternum goes down. So first of all this is connected by the capsule, and here will be the first rib, and this meniscus, besides the meniscus, the capsule strengthened by the anterior sternoclavicular, the posterior sternoclavicular, interclavicular ligaments, but the most important being costoclavicular, which the meniscus and the costoclavicular hold the medial end down into the manubrium sterni. Now there's this subclavius muscle which starts from the sternum and goes and gets inserted into this subclavius groove. So this is the subclavius muscle, and the importance of this is that this first rib is being crossed by a vein, which is the subclavian vein, and behind that subclavian vein is the scalenus and anterior muscle. So this is the scalene anterior muscle, and this muscle is so peculiar because the phrenic nerve winds round it, going into the thorax. So there's another, the 5 and 6 of the brachial plexus form the upper trunk, and they divide into the anterior posterior divisions. They have one nerve which goes as a suprascapular nerve through the suprascapular notch into the supraspinatus and infraspinatus, and another nerve which comes to the subclavius muscle. Now this nerve to the subclavius muscle gives a branch which is called as the accessory phrenic, winding around the subclavian vein and meeting the phrenic nerve. And this accessory phrenic nerve can hook this subclavian vein, cause stasis here, and result in spontaneous axillary vein thrombosis. So this is the anatomy of the medial end of the clavicle. On the lateral side, you find that there is this upper border of the scapula coming, the suprascapular notch, and a coracoid process which is parallel to the trapezoid line, the supraglenoid tubercle, the glenoid, and the lateral border. And the ligament connects the coracoid with the trapezoid line. This is called as the trapezoid part, and then another ligament goes to the conoid tubercle. So this is a conoid and trapezoid ligament which holds the clavicle articulation with the acromion process. So this ligament, the coracoclavicular ligament, is important for stabilization of the acromioclavicular joint, and costoclavicular ligament in the meniscus and the subclavius muscle is responsible for stabilization of the sternoclavicular joint. So then from the coracoid process, there is a muscle which goes to the ribs, and this muscle is the pectoralis minor. And from the inferior border, there is a fascia which is attached to the which is bounded laterally by the coracoclavicular ligament and medially by the subclavius. And this fascia, which we will color like this, is the clavipectoral fascia, coming from the clavicle to the pectoralis minor. It winds round the pectoralis minor and becomes the suspensory ligament of the axilla. The clavipectoral fascia is pierced by 4 structures which you have to answer: the cephalic vein, the thoracoacromion artery, the lymphatic, and lateral pectoral nerve. So this is the anatomy of the clavicle. So here you will be introduced to the cervicoaxillary canal. So you see that boundary is between the clavicle, which is in front, the first rib, which is medial, and scapula, which is behind. So this cervicoaxillary canal or triangle connects the posterior triangle of the neck to the axilla, which is outside the chest wall, bounded anteriorly by the pectoralis major and posteriorly by the scapula. So this cervicoaxillary canal passes the entire nerve supply and blood supply and lymphatic supply to the upper limb.